warm good morning to all of you. I, Dr. Robin Chopra, Assistant Professor in Department of Physiotherapy at RPIIT Institute of Medical Sciences Village Pastada, Karnal. I welcome you all in our YouTube channel that is RPIIT Academics. But before watching, please don't forget to like, subscribe, share and hit the bell icon. So let's start the topic. So we are continuing our topic that is principle of management. As I already discussed about the aims and the efficient first aids, then we discussed about the safe transport and different types of assessments. And after that, I already discussed about the importance of radiography. Then coming to the next point, which is that is reduction of the fracture. So mainly reduction of the fracture is to correct the displacement of fragments, and it is done by two methods. First is closed manipulation and second is open reduction. It is a surgical process, and it is mainly done by the orthopedician. So next principle of management is immobilization of the fragments either by the internal fixations and the external fixations. Starting with external fixations, we have plaster cast and plaster slabs. Also there are some external applied orthotics which are used for external fixations. And for internal fixations, we used screws, plates, intramedullary nails and different types of rods. Sometimes wires and pins also used, especially in the case of orthopedic conditions like supracondylar fractures. Ninth is early physiotherapy interventions. For the preservation of functions of the limb, mainly the local complications such as ischemia, nerve damage, joint stiffness, infection, etc., may endanger the function of the limb. So, early physiotherapy interventions are mandatory to preserve the limb functions. Then next is rehabilitation programs. After union of the fracture to restore full muscle power and joint movements and to make the patient fit for his original job. Next topic is fracture healing. As fracture healing is considered as a series of phases which occur in the sequence as follows. First is inflammatory phase in which a stage or hematoma formation occurs, and second is stage of granulation tissue in which more fibrin to the hematoma and increased blood flow. Second is reparative phase, where the stage of fibrocartilaginous callus formation occurs, and the stage of bony callus, where a woven bone replaced by calcified bone. Then third is remodeling phase. In this phase, excess material inside bone shaft is replaced by more compact bone. Then coming to the next point, that is what are the factors affecting bone healing. So we have some factors that affects the bone healing processes, mainly the enhancing and the deteriorating factors. First is starting from enhancing factor, that youth, and second is early immobilization of fracture, then third is fragments, then fourth is bone fragments contact, then fifth is adequate blood supply, then sixth is proper nutrition, then seventh is adequate hormones, then eighth is growth hormone, then ninth is thyroxine, and 10th is calcitonin. Then next is inhibiting factors, starting from first point, that is age, as the infants of less than 4 weeks are more hyperkinetic, so it disturbs the healing process, and the teenagers between 12 to 16 weeks are more likely to play, so which causes the delayed wound healing. And the second point is extensive local soft tissue trauma. Then third is bone loss due to the severity of the fracture. Then fourth is inadequate immobilization or motion at the fracture site. Then fifth is presence of infection which leads to the delayed healing. Then seventh is which is a very complicated condition which is known as avascular necrosis. So guys, hope so you all understand very well, And for more information, please stay tuned, stay healthy, happy. Till then, take care, goodbye, farewell. And please don't forget to subscribe this channel.